Right now, at this very moment, millions of people over 65 are taking vitamin supplements they believe are protecting their health. They've been told these vitamins are essential, that they're filling nutritional gaps, that they're preventing disease. But what if those same supplements are actually creating microscopic blood clots in their brain? What if the very pills they're swallowing every morning with such discipline are quietly increasing their stroke risk by percentages that would shock them if they knew the numbers? This isn't about minor side effects or theoretical risks found only in laboratory studies. This is about 8 specific vitamin supplements that have been directly linked to increased stroke incidence in adults over 65. And the mechanisms behind these connections are more disturbing than most doctors are willing to discuss with their patients. Before this video ends, you're going to understand exactly why your age changes everything about vitamin supplementation, which specific supplements are creating the greatest danger, and what you need to do immediately if any of these are currently in your medicine cabinet. If you're over 65 or you're caring for someone who is, make sure you're subscribed to this channel and that notification bell is turned on, because we're covering information that could prevent a catastrophic health event, and we're doing it without the pharmaceutical industry filter that keeps this research buried in medical journals where the general public will never find it. Drop your age in the comments right now so we can understand who's watching and who needs this information most urgently. And let's be absolutely clear from the beginning. If you're experiencing sudden numbness on one side of your body, difficulty speaking, severe headache with no known cause, or vision problems in one or both eyes, you need to call emergency services immediately. Those are stroke symptoms requiring urgent medical intervention, not internet research. Here's what makes this topic so dangerous and so widely misunderstood. The supplement industry has convinced the public that vitamins are universally beneficial, that more is always better, that these are natural substances incapable of causing harm. Meanwhile, your body after 65 is fundamentally different from your body at 45 or even 55. Your liver metabolism has slowed by approximately 20 to 30%. Your kidney filtration rate has decreased by roughly 1% per year after age 40. Your stomach acid production has declined significantly, changing how you absorb and process nutrients. Your vascular system has accumulated decades of microscopic damage and inflammation. And perhaps most critically, your blood's clotting mechanisms have shifted toward a prothrombotic state, meaning you're already predisposed to forming clots more easily than younger adults. When you introduce high-dose vitamin supplementation into this aging physiological landscape, you're not simply filling nutritional gaps. You're introducing powerful biochemical agents into a system that processes them differently, eliminates them less efficiently, and responds to them in ways that can trigger cascade effects leading directly to stroke. Entender en endursat. The research documenting these connections has been published in peer-reviewed journals for years, but it remains almost completely unknown outside specialized medical circles because it contradicts the multi-billion-dollar narrative that vitamin supplementation is universally safe and beneficial. Let's start with the first supplement creating stroke risk that almost no one is warning about: high-dose vitamin E supplementation above 400 international units daily. Vitamin E is typically marketed as a powerful antioxidant that protects your cells, supports your immune system, and maintains healthy skin. What the labels don't mention is that vitamin E is also a potent anticoagulant that interferes with your blood's normal clotting mechanisms. In adults over 65, this anticoagulant effect becomes genuinely dangerous. Here's the mechanism you need to understand. Vitamin E inhibits platelet aggregation, which is the process where blood cells called platelets clump together to form clots. It also reduces the production of thromboxane, a substance your body uses to promote clotting when you're injured. For younger people with robust vascular systems, these effects are usually mild and manageable. But for adults over 65, especially those with any degree of arterial plaque buildup or vascular inflammation, vitamin E supplementation creates a precarious situation where normal protective clotting is suppressed while abnormal clot formation in areas of vascular damage isn't prevented. The result is what's called a hemorrhagic stroke, where blood vessels in the brain rupture and bleed because the blood has lost its ability to clot properly at the site of vascular weakness. The landmark study that should have changed everything about vitamin E recommendations was published in the Journal of the American Medical Association in 2005. Researchers analyzed 19 clinical trials involving more than 135,000 participants and found that vitamin E supplementation at doses above 400 international units daily was associated with increased all-cause mortality, with hemorrhagic stroke being one of the primary mechanisms. But here's where it gets even more concerning. Most multivitamins contain between 200 and 400 international units of vitamin E. Many standalone vitamin E supplements contain 400 to 1,000 international units. And because vitamin E is fat-soluble, meaning your body stores it in fatty tissues rather than eliminating it daily through urine like water-soluble vitamins, taking these supplements consistently builds up dangerous concentrations over time. If you've been taking a high-dose vitamin E supplement for months or years, your tissue stores are likely far above what your aging vascular system can safely manage. The second supplement increasing stroke risk is vitamin A in the retinol form at doses exceeding 5,000 international units daily. Vitamin A is essential for vision, immune function, and cellular health, but the retinol form creates specific dangers in aging adults that the beta-carotene form does not. Retinol at high doses increases blood viscosity, making your blood literally thicker and more prone to clotting. It also promotes inflammation in the endothelial cells that line your blood vessels, creating the exact conditions where clots are most likely to form. Research published in the American Journal of Clinical Nutrition demonstrated that adults over 60 consuming more than 5,000 international units of preformed vitamin A daily showed significantly elevated markers of systemic inflammation and increased carotid artery intima media thickness, which is a direct measurement of arterial damage and a strong predictor of stroke risk. The danger is compounded by the fact that vitamin A, like vitamin E, is fat-soluble and accumulates in your liver and fatty tissues. You can't simply stop taking it and expect immediate reversal of the effects. It takes months for stored vitamin A to decline to safe levels. The third supplement that needs immediate attention is calcium supplementation above 1,000 milligrams daily without adequate magnesium balance. This is one of the most common supplementation patterns in adults over 65, especially women who've been told for decades that calcium prevents osteoporosis. What hasn't been clearly communicated is that calcium supplementation, particularly in the form of calcium carbonate, creates arterial calcification when taken without sufficient magnesium and vitamin K2. Here's what happens inside your body. When you consume high-dose calcium supplements, your blood calcium levels spike temporarily. Your body responds by depositing that excess calcium somewhere, and in aging adults with inflammation and existing vascular damage, that somewhere is frequently the walls of your arteries. This process, called vascular calcification, makes your arteries rigid and creates plaques that can rupture, triggering the clot formation that leads to ischemic stroke. A groundbreaking study from the National Institutes of Health published in 2016 followed more than 60,000 Swedish women for 19 years and found that those taking calcium supplements above 1,000 milligrams daily had a 40% increased risk of stroke compared to those not supplementing. The mechanism becomes even more dangerous when you understand that most adults over 65 are already getting adequate calcium from from their diet through dairy products, fortified foods, and leafy greens. The supplementation adds excess calcium that your body cannot properly metabolize or utilize, creating a surplus that gets deposited in exactly the places you don't want it: your arteries, your kidneys, and the soft tissues of your cardiovascular system. The fourth supplement creating stroke risk is iron supplementation above 18 milligrams daily in the absence of confirmed iron deficiency anemia. Iron is absolutely essential for oxygen transport and cellular energy production, but excessive iron creates oxidative stress that damages the endothelial lining of your blood vessels. This damage triggers inflammation, promotes clot formation, and accelerates atherosclerosis. The danger is particularly acute in adults over 65 because your body's ability to regulate iron absorption and storage declines with age, and because most people in this age group are not actually iron deficient. Research from the European Heart Journal demonstrated that elevated serum ferritin levels, which reflect body iron stores, are independently associated with increased stroke risk. Adults with ferritin levels in the highest quartile showed a 63% increased risk of ischemic stroke compared to those in the lowest quartile. The terrifying part of this finding is that taking iron supplements when you don't actually need them is exactly what drives ferritin levels into that dangerous highest quartile. Here's what makes this particularly insidious. Many adults over 65 take iron supplements because they feel tired and assume they're anemic, or because a well-meaning doctor suggested supplementation without actually testing their iron status. But fatigue in older adults has dozens of potential causes, most of which have nothing to do with iron deficiency. Taking iron supplements without confirmation of actual deficiency is essentially gambling with stroke risk based on a guess. The fifth supplement that demands your immediate attention is vitamin D at doses exceeding 4,000 international units daily without concurrent vitamin K2 and magnesium supplementation. This statement is going to shock people because vitamin D has been positioned as a miracle nutrient that everyone should be taking at high doses. The reality is far more complex and far more dangerous for adults over 65. Vitamin D increases calcium absorption from your digestive tract. This is beneficial when you have adequate vitamin K2 to direct that calcium into your bones and adequate magnesium to keep it from depositing in soft tissues. But when you take high-dose vitamin D without those cofactors, you're dramatically increasing blood calcium levels without the mechanisms to properly utilize that calcium. The result is the same vascular calcification we discussed with calcium supplementation, but triggered through a different pathway. Studies published in the Journal of Clinical Endocrinology and Metabolism have shown that vitamin D supplementation above 4,000 international units daily in adults over 65 is associated with increased arterial stiffness and elevated coronary artery calcium scores. These are direct measurements of stroke and heart attack risk. The researchers concluded that while vitamin D deficiency is certainly problematic, excessive supplementation creates dangers that may outweigh the benefits, particularly in aging populations with compromised vascular health. The sixth supplement increasing stroke risk is niacin, also called vitamin B3, at doses above 500 milligrams daily when used for cholesterol management. Niacin at high doses can lower LDL cholesterol and raise HDL cholesterol, which is why some doctors prescribe it or why people self-medicate with over-the-counter niacin supplements. But high-dose niacin creates what's called a rebound effect, where triglyceride levels and inflammatory markers spike between doses, and it can trigger abnormal heart rhythms, particularly atrial fibrillation, which is the single greatest risk factor for ischemic stroke in adults over 65. The mechanism works like this. Atrial fibrillation causes the upper chambers of your heart to quiver rather than contract normally. This irregular rhythm allows blood to pool and stagnate in the heart chambers where it forms clots. When those clots break loose, they travel through your bloodstream until they reach a vessel too small to pass through, and in approximately 15% of cases, that blockage occurs in the brain, causing an ischemic stroke. Research from the American Heart Association found that adults over 65 taking high-dose niacin showed a 34% increased risk of developing atrial fibrillation compared to controls, and those with atrial fibrillation faced a 5-fold increase in stroke risk. The seventh supplement creating danger is vitamin K1 at high doses above 500 micrograms daily in people taking warfarin or other blood-thinning medications. This is a specific interaction risk rather than a universal danger, but it's critically important because millions of adults over 65 are on anticoagulant therapy. Vitamin K1 is the form found in leafy green vegetables and in many multivitamin supplements. It directly counteracts the effects of warfarin by promoting blood clotting, which is exactly what warfarin is prescribed to prevent. When someone on warfarin takes a supplement containing high-dose vitamin K1, they're essentially neutralizing their medication without realizing it. Their blood returns to a pro-clotting state while they believe they're protected by their prescription. The result is dramatically increased stroke risk in a population already identified as high risk, which is why they were prescribed anticoagulants in the first place. Not in Dirisan and Tersir. The danger isn't theoretical. Emergency departments see patients regularly who've experienced strokes while on warfarin therapy, and investigation frequently reveals recent changes in vitamin K intake through supplementation. The eighth and final supplement that needs to be on your radar is folic acid at doses above 800 micrograms daily in people with undiagnosed vitamin B12 deficiency. This is a subtle but devastating mechanism that's particularly relevant to adults over 65 because vitamin B12 deficiency becomes increasingly common with age due to decreased stomach acid production and reduced intrinsic factor, which is a protein necessary for B12 absorption. Here's what happens. Folic acid supplementation can mask the symptoms of vitamin B12 deficiency, allowing the deficiency to progress undetected while causing permanent neurological damage. One of the consequences of severe B12 deficiency is elevated homocysteine levels, and elevated homocysteine is a well-established independent risk factor for both ischemic and hemorrhagic stroke. Research published in Stroke Journal of the American Heart Association found that adults over 65 with vitamin B12 deficiency who were taking folic acid supplements showed a 42% increased stroke risk compared to those with normal B12 status. The tragedy of this mechanism is that people take folic acid believing they're protecting their health, particularly their cardiovascular and cognitive health, while unknowingly allowing a B12 deficiency to cause the exact damage they're trying to prevent. The solution isn't to avoid folic acid entirely, it's to ensure your B12 status is adequate before supplementing with folic acid, which almost no one does because most people are supplementing without any medical supervision or laboratory testing. Now that you understand these 8 specific supplements and their stroke risk mechanisms, let's talk about what you need to do immediately. First, create a complete inventory of every supplement you're currently taking, including multivitamins, standalone supplements, and any functional food products fortified with vitamins. Write down the exact dose of each vitamin in each product. Many people are getting dangerous doses without realizing it because they're taking multiple products that contain the same vitamins. Second, compare your total daily vitamin intake against the tolerable upper intake levels established by the National Institutes of Health, not the recommended daily allowances. The upper intake levels represent the maximum amount that's considered safe, and they're specifically age-adjusted for for adults over 65. If you're exceeding these levels for any of the 8 vitamins we've discussed, you need to make changes immediately. Third, schedule an appointment with your physician to discuss your supplementation regimen and to request specific laboratory testing. You need to know your actual vitamin D status, your iron status through a complete iron panel including ferritin, your calcium levels, your vitamin B12 and folate levels, and your homocysteine, non-understeuring underlying nutrients. Supplementing without knowing your actual status is guessing, and when it comes to stroke risk, guessing can be fatal. Fourth, if you're taking any blood-thinning medications including warfarin, apixaban, rivaroxaban, or even daily aspirin, you need to have a specific conversation with your doctor about every supplement you're taking because the interaction risks multiply dramatically when anticoagulants are involved. Fifth, understand that food-based nutrition is almost always safer than supplementation for adults over 65. The vitamins and minerals you get from whole foods come with natural cofactors, are absorbed more slowly, and don't create the blood level spikes that supplements produce. Focus on a nutrient-dense diet rich in vegetables, fruits, quality proteins, and healthy fats before reaching for supplements. If you found this information valuable and potentially life-saving, make sure you're subscribed because we're continuing to expose the health risks that institutional medicine isn't clearly communicating to the public. Share this video with anyone over 65 who's taking supplements because this information could prevent a stroke that would otherwise be dismissed as bad luck or inevitable aging. The truth is that many strokes in older adults are directly connected to supplementation patterns that could be modified if people simply had access to accurate information. Remember, this information is for educational purposes and is not a substitute for personalized medical advice from a qualified healthcare provider who knows your complete health history and current status. But it is information you deserve to have so you can ask the right questions and make truly informed decisions about your health. Your health is your responsibility, and knowledge is the foundation of protection.